Assalamu alaikum. How are you, everyone? We are back. We will start today's session. We have Mr. Ahmed, came with 25 years with complaint of hematuria. We will share the timer, then we can start. Okay, let's start.
Hello, my name is Dr. Hussein.
Hello, doctor. Hello. No voice, صح?
Yeah, Dr. Mahmoud. Yes, adjust your mic, please. I will restart again. Adjust your mic. We can't hear you.
Hello, my name is Dr. Hussein, one of the medical doctor in Kenya. Mr. Ahmed.
Yes, I am, doctor.
Mr. Ahmed, I'm here today with you to examine you and address your concern. Is that okay?
Yes, okay.
Mr. Ahmed, it came to my knowledge that you passed uh, water, blood water. Tell me more about that.
Yes, doctor. I have this actually since like five days, doctor. And I'm really afraid from this. I want to know what could I have.
I'm sorry for what happened to you, Mr. Ahmed. This did it start rapidly or gradually?
Start gradual.
This first time, or you have attacked?
Yes, it is first time.
Mhm. Did you this blood of your water work, is that increase or decrease from starting or same?
Yes, it's coming and go, doctor, and during 5 days, not always with me.
Mhm. On and off, I understand that.
Mhm.
Okay. Do you notice anything make it worse? Any kind of food?
No, doctor, I didn't notice that.
Mhm. Do you have a tummy pain with this bloody water work?
Um, no, doctor, I have no
Mhm.
any tummy pain.
Uh, this uh, uh, this bloody water work at the beginning of passing water or at the end or whole?
Actually, it is in the whole steam.
Mhm. I'm so sorry. Do you have any trauma to your tummy or your back?
No,
Mhm. Do you have any bleeding from your nose?
no,
Any sneezing,
no,
cough,
no,
coughing up blood?
no,
Do you have any sort of pain?
no,
Any sort of pain in the last 2 weeks?
no,
Okay. Any change in your water frequency,
no,
amount?
no,
Do you have any high, high body temperature,
no.
lump or bump in
Yes,
nose?
doctor. Yes, doctor. Actually, I have temperature. It's coming and go like 6 months.
Since when?
6 months.
6 months. Mhm. Sorry for that. This high body temperature, low grade or high grade?
It is low grade.
Is it night sweating?
Yes.
Since when?
Same duration.
Same. Okay. Do you have chest pain?
No. Yes.
Yes, you have.
Actually, I have no any chest pain, but sometimes I feel like chest discomfort sometimes.
Since when this discomfort?
Just like 1 week.
Mm-hmm. Uh, do, any difficulty breathing?
No.
Noisy chest?
No.
Mm. Do you have any traveling history?
Yes, I went to Kenya since like 2 times, 2 months.
2 months ago?
Yes.
Mm-hmm. Do you receive precaution before
Yes.
traveling?
Yes, they gave
Mhm.
me treatment and I finished all my course.
Mhm. Also, during traveling, do you have any contact with patients with cough?
No.
Contact with the water bowl?
No.
Mhm. Okay. Mr. Ahmed, any past medical history I should be aware of?
Um. Uh. No, doctor, I haven't.
No high blood pressure,
No.
high blood sugar,
No.
kidney problem?
No.
Mhm. Uh, Show me your medication list.
I'm not using any medication. Only this paracetamol from time to time for this high temperature.
I'm so sorry for this question. Any recreational drug?
Um. No, doctor.
Hearing needle?
To be honest with you, yes.
Mhm. Since when this? Hearing needle?
Um. Since a long time, doctor, like 2 years.
2 years. Mhm. Any over-counter medication?
No.
Are you married?
No.
Are you sexually active?
No.
Mhm. Okay. Any family history of disease?
No. Like what, doctor?
Any kidney disease in your family?
No.
Any family notes I should be aware of?
No.
What's your job?
I am a student, doctor. University student.
Mhm. Do you smoke?
Yes.
How many cigarettes? For how long?
Sometimes 6, sometimes 7.
Mr.
Since
Ahmed? Mhm.
since like 3 years.
I highly advise to stop this smoking. Okay.
Okay, doctor. I will think.
If you don't mind, I will refer you to physician clinic. Physician clinic.
Thank you, doctor.
Okay.
I appreciate that. Thank you. Okay.
Mhm. Okay. Do you have any headache?
No.
Weakness?
No.
Any sensation change elsewhere in your body?
No.
Unsteadiness?
No.
Vision problem?
No.
Mhm. Any skin rash?
Oh yes, doctor. Here,
Where?
skin rash in my hand, doctor. Uh, in the arms, forearms, I mean. Purple rash.
Perfect. Since when this perfect rash?
It's like 2 months like this.
Is it itchy?
No,
Is it lumpy?
no,
Woozy?
no,
Painful?
no,
Do you have a joint pain?
no.
Okay. Any change in your weight?
Yes, I feel that I lost weight, doctor. During this 6 months, I lost like four kilograms.
4 kilo over this 6 months. Is it intentional?
No,
What about your appetite?
little bit decreased, doctor.
Little bit decrease. In same period, okay? Do you have throwing up?
Yeah, no, doctor.
Throwing up blood?
No,
Tummy pain? Tummy distension?
no,
Change in your bowel habits?
no,
Bleeding with the back passage?
no,
Okay. Any weather preference?
no,
Handshake?
no.
Mhm. Okay, Mr. Ahmed, let me to examine you and ask you some questions, okay?
Okay.
Mm. Uh, General look for the patient, build, average, underweight, overweight,
His average weight.
underweight. Give me vitals,
Average weight. Vitals.
average,
Normal.
normal, no tachycardia,
Not take a
no
card,
high,
but there is high temperature.
what?
38. High temperature 38.
38, 38,
Mhm.
okay. Mm-hmm. Okay. Any stigmat of infective endocarditis in the bone or the nails, splinter, hemorrhage, clubbing,
It's all positive.
what?
Positive. All positive.
I will examine, yeah. I will check eye for blur and jaundice.
Color, yes.
What?
There is color. No jaundice.
There's blur, no jaundice. Mhm. Okay. Also, I want to check for rosy spots, okay, in the eyes. Chest examination, pericardium,
What you want to see in the chest?
scar, sternum scar,
Negative.
okay, sterile,
Negative.
murmur,
What is the measurement that you want to check for? What measurement that you want to start to check?
uh, I want to check for that pansystolic murmur.
Okay.
Is
Where
it
I
or
mean
not?
where yeah, I mean where is the site in time? Where is the site exactly that you will start in this patient?
Tricuspid area.
Okay. Yes, positive.
Move it.
2 minutes remaining.
Okay. Raise GAVB.
Yes,
Okay. Basal crepitation.
positive.
Splenomegaly.
Negative.
Okay. Lower limb swelling.
Positive.
Okay. I will also examine this rash.
Yes.
Mr. Your concern.
What is my problem, doctor? Why I have this bloody waterwork?
I highly appreciate your concern, Mr. Ahmed. You said to me, and after examining you, most likely you have condition called infective endocarditis. it is a medical term of medical condition in the series. Bug infection inside your heart, leading to symptoms that you have. So what we need to do is admit you and run blood test and imaging. Okay, and also give you medication in form of called antibiotic. And also your plan of management will be under the team from heart doctors, social workers, to give you proper plan of management. Is that okay?
Okay, doctor, thank you.
Okay, are you done?
Let's
go to the examiner.
Okay. What is your differential for this case?
Okay, my differential is infective endocarditis. Could be also post also IgA nephropathy. Could be post streptococcal infective endocarditis.
Okay. Can be BNH?
Be what?
Can be BNH, paroxysmal nocturnal hemoglobinuria?
No. Unlikely.
Okay. You exclude it?
Why is the PNH present with the hematuria and no pain if suspected the renal vein thrombosis? No pain.
Okay. Okay. Can be kidney cancer?
Okay. Unlikely.
Okay. What is your workup for the patient?
I will do blood lab in the form of full blood count, liver function test, renal function test, electrolytes, inflammatory markers. Also, I will do urinalysis, and also will do specific investigation for this for my diagnosis because blood culture.
الصوت بيها شوية قلت شنو؟ النص.
I will do a base lab in the form of full blood count, liver function test, renal function test, electrolytes and inflammatory markers, and urinalysis. And also I will do specific confirm diagnosis in the form of blood culture, ECG, echo.
Yes.
After
Anything
that,
more? Yes.
yes. Treatment non-pharmacological education and counseling of the patient about his condition, advice to refer him to multidisciplinary team from cardiologists and social workers, and also to to stop this narcotic drugs, and pharmaceutical in the form of antibiotics.
Yes. Okay. Any other thing you want to add in the treatment? Nothing. Okay. Okay, خلاص ماشي. Examiner question.
So the investigation done, completing investigation.
Yes. He asked about investigation.
So okay, investigation for the complication.
Yes.
The image did he mention the image scan?
He said that blood culture, ECG, and echo only.
Okay, for the kidney.
He did not mention about the kidney. He said that renal function tests are analysis. Yes.
Okay, what the lesion in the lesion in the hand, Dr. Mahmoud? You suspect the skin rash. Dr. Mahmoud,
What?
the rash, skin rash. What do you suspect? Okay, let's go to Dr. Awatif comment, then I will comment. Thank you, Dr.
Okay.
Mahmoud. Yeah,
Okay.
start, Dr. Awatif.
Okay. Uh, give 1 minute. طيب بالنسبة للأناليسيس عامة إن هو يعني ضبط الكيس ما شاء الله catch the case early ما شاء الله. About the analysis of hematuria, just there is this important question about if there is any other side of bleeding, because this can be also um, blood disease or bleeding disorder. He didn't check about this. About differential also BNH. I asked about BNH, Dr. Mahmoud, because this patient he said blood may it is not a blood in the urine, may it is only red urine. That's why we need to exclude other. We also important to check the severity of this hematuria. To ask if there is any blood clot. Also, to ask if it is bloody water work, it is associated with any pain or not. You ask it about tummy pain, and also can be any other pain like burning, maturation, and like this, or pain in the flank can be complicated polycystic kidney, for example, or any other thing. Okay. About other differential, he asked about it all, mashallah. Um, about this chest discomfort, Dr. Mahmoud did not analyze well this chest discomfort. At least what mean pain, the side of discomfort. But he asked about this breathing difficulty. This is good. He tried to clarify if there is breathing difficulty. This is good. Analyze the traveling history in good way. He didn't ask in the cardiovascular system involved about the lower limb swelling. I think Dr. Mahmoud, he did not ask about the lower limb swelling. But
He examined it. He examined it at the end.
he
Yes.
examined it, yes, but in the history, I mean. Yes, about Butler also, he did not ask about it, but examine it. And also, he asked it about thyroid. I don't know what is the relation between thyroid and this, but he asked it about weather preferences, I think. He asked it about risk factor of TB in a good way. Yes, about the differential, cancer is one of the differential because he also has a lot of weight in a short period. I think the cancer will be up in the differential because there is no any history of chest or upper respiratory tract infection. That's why we need to put cancer up because of the constitutional symptoms is positive. And BNH will be there because not excluded in the history, so will be there unless it's excluded in the history. About investigation, yes, but because this at the end it's bleeding, so we need to do workup related to the bleeding, like coagulation profile, cross matching, and blood grouping. Uh, the other is good. I think Dr. Basim talk about imaging of renal also. About the treatment, yes, He mentioned also about stopping the risk factor, counseling the patient about this recreational drug that taken by needle sharing. Treatment also for acute presentation of the patient, because the patient came to you in heart failure, to treat the heart failure also by giving diuretics and like this. But the other of the treatment, good to treat disinfect endocarditis, to stop the risk factor. Yes, everything is okay. That's my opinion.
Okay, thank you, Dr. Awatif.
I think
So let's start from the beginning, but please, before starting, Dr. Awatif and Dr. Mahmoud, the sound was not clear much. So for the next case, please adjust the mic to be more closer and to be more clear, the sound. For you and Dr. Mahmoud, Dr. Awatif.
أيوة
Okay,
السماعة كانت بعيدة ما انتبهت. أوكي تمام.
okay. So I will comment from the beginning. Onset course duration, as Dr. Mahmoud started. Yeah, he confirmed the name, the complaint, the age of the patient. Then he asked, I read about your bloody water work. If you are not sure about the jargon, if you don't want to mention hematuria, for example, this is in general. I am talking in general for other colleagues and candidate. You can ask, tell me about your complaint. That's it. Or what brought you to the clinic today? If you are worried to say something which can be jargon for you, you can say that. Can you tell me more about your complaint? So he will tell you what he had. This is the start. Then onset course duration. Dr. Mahmoud started in good way. Onset, it was gradual. The course on and off duration of 5 days ago. And very important question here. In previous attack, or this is the first attack? It's important to be asked. Okay. Just in case of previous attacks, you can suspect something in the reflux or renal stone, for example, on and off. So this is very important. What worse, what improve? Yeah, and the most important question here, when exactly? Is it at the beginning, at the end, or all through? So in this case, it was all through. You conclude glomerulonephritis. But if the beginning, you will suspect with the urethra, and at the end with bladder, all through will be glomerulonephritis. Okay, any pain there? It's very important that the pain, because the pain means that it's a case of stone or UTI. Yeah, so this is but in this case, mostly the pain will be in the kidney or flank pain. In the renal stone, you will find the pain in the flanks radiated to the groin. Okay, he asked for the tummy pain as well. Then the trauma. If you have any trauma before, I think this is for the urethral pulse. Apart from this, he asked for the genitourinary symptoms question, any change of the color, amount, or frequency. Sorry, I will write the case. Someone delete the history of the case from the board. I will write it again, sorry. Okay, till the board will come back. Yes, Mr. Ahmed. Okay. Then he asked about the constitutional symptoms. It's important. This patient has 6 months history of high body temperature. It was low grade, so you can suspect about either serious infection, either TB or infective endocarditis, as in our case. Sweat, night sweat, it's important as well. Weight loss, yes, serious infection or malignancy. That's why Dr. Awad put for him differential for renal cancer, renal cell carcinoma. Appetite was poor due to also serious infection. This for the constitutional. If you have complicated patient, such our case, you can ask for the previous medical history. If the patient has any previous long-lasting disease like high blood pressure, high blood sugar, as Dr. Mahmoud did. And very important question, with any blood or bloody disease, you can ask the patient, have you taken any blood thinner medication, which is a question missed by Dr. Mahmoud. It's important question here. Have you ever take any blood thinner medication for any reason? Might the patient take warfarin and this is the reason of his hematuria? Or in some medication, you can suspect blood red urine, sorry, like phenytoin or rifampicin. Sorry, not phenytoin, it's rifampicin. You can ask about also medication or medication list. Very important here also the color of the urine. Dr. Mahmoud missed also the color. Is it cola-like, or it's pure blood, or dark, or the urine being dark on standing, just to roll out or to roll in the acute intermittent porphyria. Another question important in this patient, you can ask about the early morning darkening of the urine for PNH, along with family history. So this is the way how to analyze the hematuria from genitourinary system. Let's go to the system review. In this patient, it will be quick because already the case was caught by Dr. Mahmoud. It's infective endocarditis. So the other system review, CNS, mostly nothing there. GI, also nothing will be there. Endocrine, just weather preference, it's unlikely to be related to the case, but it's okay. You can ask. Cardiovascular, you missed the cardiovascular system for chest pain or awareness of heartbeat, because with this hematuria, patient might have anemia and he will be having the arrhythmia or feeling of palpitation. Joint pain, no, I was not in the case. Skin rash was positive for 2 months, but he didn't. Yes, he analyzed it, but he didn't examine at the end. So better in the start when you have skin rash, show me the rash. At the moment you have a rash, yes, show me the rash. Even the history taken, no problem. You can see it, and uh, further you can ask, but better to ask before because you might forget to analyze or to see it in the examination. So I prefer if you ask for the skin rash at the history same time. Okay, the family history important in this patient to rule out any kidney disease like autosomal dominant polycystic kidney disease, kidney cancer, all or renal stone as well. It's important for the family history. Travel history important. Yes, true for the some infectious disease, malaria or TB. It's important here because still TB can be cause of hematuria, papillary necrosis. Okay. It was positive for Kenya. He analyzed it well. How to ask in the travel history? This is general question, not specific to the case. So if you have patient with travel history, you suspect something related to his travel, you can ask when and did you have any contact with sick people? And what about the prophylaxis before and after? This is the common question for travel. Another analysis for the travel, for the food poisoning or for any gastrointestinal, you can ask about the food source. For the pneumonia, you can ask for the hotel stay, and for example, Lyme disease, any hiking. I'm talking about general, not about this case. Okay, let's go to the medication, any high blood sugar, any high blood pressure, then any surgery, any allergy to any medication, any over
Sorry,
counter.
Dr. Qasim, why you
Yes,
mentioned
yes.
Lyme disease?
What? Lyme? No, no, I'm talking in general, Dr. Rawat, not in this case. Even in this case, it was irrelevant. It's not related to his travel, isn't? The Kenya travel
Yes,
was not related. Yeah, I'm just
just
telling
it's
in
just
general. Yeah, yeah,
distracting. Yes,
yeah.
yes.
Yes, yeah. Okay, let's go to the HIV. It's very important, this patient, and he caught that case from this history when he asked about sharing needles. Although he asked about recreational drug and you denied it, but he asked about sharing needles and it was positive. And
This
in this,
actually can happen in the exam, like this
yeah, to
recreational
distract,
and risk factor. No, this recreational and this HIV risk factor sometimes the patient can deny. And here, if you have differential, strong differential that this can be related to recreational or something like this, uh, to to ask the patient again, like. This is according to Dr. Tariq. One session I attended with him. Sometimes the patient can deny like these questions: recreational drug, needle sharing. You can ask the patient again that you are not judge him. Sometimes in the long session can happen. You can use
okay,
this only if there is a strong differential like
suspicion.
this infected
Yeah,
endocarditis. Yes, suspicion, strong suspicion. Yes, you can use this. Not in any case.
okay. But he didn't advise about sharing needles. This is very important. Immediately, when you have something related to the case and it's a risky habit, immediately advise about it. He's sharing needles. First, to analyze what you are sharing, what the substance you are sharing. I'm sharing heroin, I'm sharing morphine, I'm sharing whatever, the medication or the drug, and how is the root of the sharing for the creational, I mean. If he said I'm sharing or needles, this should be stopped. You tell him, I advise you to stop this sharing because it's risky habit. It might harm you in general and specifically in your condition. Okay, if he's doing by sniffing, you can advise him, please don't do that because again, it's harming your heart, your systems like CNS. It can cause the headache. I'm talking in general. But whatever you have positive finding, immediately advise about it. It might transfer to you some disease called HIV for the sharing needles. In this condition, infective endocarditis, yes, but also it can be risk for transmitting the HIV. Okay, then the occupational, the job, the smoking, but alcohol was missed. I don't know. Dr. Mahmoud didn't ask about alcohol. And for this case, no reason to ask about driving. It's not harming or it's not related. Okay, the examination. He start to examine the vitals, the general look, underweight, yes, most probably, and the vitals and the blood pressure, the temperature was high, but still low grade fever, 38. Then immediately he asked about stigmata of infective endocarditis. You can mention to the examiner, Genway lesion, ocular nodule, and in the eye, also rough spot. You can mention to the examiner what you are searching for or what you are looking for, just to show the examiner that you know what you are doing. In the hand, finish. We said the stigmata of infective endocarditis in the hand. The pulse, you should do examine the pulse. How is it? Is it regular, irregular, any delay? and the pulse character is it's collapsing. Sometimes also there is if the valve fiction might cause collapsing valve, collapsing pulse. So you can ask also about the criteria of the pulse. Then you will go to the neck for the congested neck veins. It's very important. Heart failure or tricuspid regurg signs. Lymph nodes in the neck, very important for any HIV or infective endocarditis. Still positive, can be positive. For the face, you will go for the eyes for the jaundice and pallor. In this patient, you might have jaundice, pallor due to the anemia, and yeah, the rose spots in the eyes for infective endocarditis finding. You can use slit lamp, offer a slit lamp, or you can mention it in the examiner time. Very important, the heart examination. Tricuspid regurg, mostly due to the injection. Yeah, I forget the injection marks in the hand. Injection marks in the cubital area, or you can offer the inguinal. So this is the accessible area for the injection medication or the injection drug. Okay, the heart, you will examine the apex. Where is the apex? Detect the apex first, then ask about the murmurs, mostly over the tricuspid area. Yes, and sometimes in the mitral. And the signs of heart failure, as I said, congested neck veins, and fine basal crackles in the back. Then examine the flank for kidney, I mean, to rule out polycystic kidney, large bulbable kidneys or palatable kidneys. It's important. And at the end, offer for the genitalia, rule out any urethral cause. The leg examination for lower limb edema will be the last step for the examination. This is our case, and the differential, as mentioned by Dr. Awatif, infective endocarditis, then post-septococcal glomerulonephritis or IgA nephropathy. All of them are glomerulonephritis case. Polycystic kidney can be if there is positive family history, but I don't think to be mentioned here. Renal cancer can be also there, but against that, no, it's not nothing against renal cell carcinoma. So you can mention, yes, renal cell carcinoma, infective endocarditis, and post-streptococcal glomerulonephritis. So this is our case. In the investigation, we'll start from baseline basic workup. CBC, inflammatory marker, very important, ESR, CRP, and urea creatinine, electrolyte, liver function test, and very important to mention blood culture. 2 sets, 12 hours apart. This is specific for the case here. This is for investigation. The image will do scan for the kidney, ultrasound for Doppler for the renal vessels. You can do ECG, echocardiogram, and slit lamp or for the eye. It's very important. Multidisciplinary team approach, very important to mention, starting from the nephrology, infectious disease, and cardiologist, hematologist, urologist, social worker, and GP, and specialized nurse. Pharmacological, you will start empirical antibiotics for infective endocarditis until the culture will be released. This is the case. If anyone want to comment or ask question, I'm trying to be faster just to do another case. So the comment here, paroxysmal nocturnal hemoglobinuria, Dr. Heda, prothrombotic state and thrombocytopenia. I don't think paroxysmal nocturnal hemoglobinuria will be in the differential in this patient because the character of the blood, it's not blood, dark urine in the early morning. So I don't think it's in the differential. Can someone share the scenario? Okay, then LS, blood pressure, offer fundoscopy, blood culture from multiple sites. Peripheral, it's two blood culture peripherally and 12 hours apart. Autosomal polycystic kidney disease can be indifferential. If there is a family history, yes, I agree. But if no family history of kidney disease, I don't think it's relevant in this patient. Okay, Dr. Awatif, any question? Any comment? Dr. Mahmoud? Anyone? Is it clear?
No, thank you.
In the patient counseling and the education, Dr. Mahmoud, it's very important to mention the drug abuse. Very important. One of the important steps to mention to the examiner that we should advise the patient to stop or to refer him to addiction center because it's very important. And the HIV screening, very important. This patient I didn't mention. HIV is very important in this patient. Okay. No question. We can move to.
We can
Yes.
talk about regarding the sharing the needle, about the needle exchange program. They can give him a needle without needing for sharing. So this is in the NHS. There's many service in the NHS that are serving the needle exchange program. We can give him needles free.
So, can you tell us more about this? What the meaning of this program?
Yes, in the UK, I'm working in the UK. So in the UK, for any people who are sharing needle, we can advise them to go to the needle exchange program. They are providing them with the needle they will have needle for free, so they don't need to share needles with other people. This is one of the service for intravenous drug users here.
Yeah, so they can share or they can take the drug without share. This is your
No,
meaning, right?
they are giving the patient needle for free. The patient can go to the pharmacy or can go to the NHS service. They can give them a free needle for IV drug users. So they will have free needles, so they don't need to share needles with others. This is the needle exchange program. It's called here needle exchange program.
I didn't hear about that, doctor, but if you have good information about that, you can share us in the
Yes.
group.
Yes,
Yeah.
this is here we are doing this because I'm working as a HIV
Okay.
registrar. So we have patients that they are sharing needle. So we'll transfer them to the needle exchange program. They can go to
Okay.
the front and take the
So,
needle for free.
so he will take the drug by
No,
safe
the
needle,
needles.
you mean?
Yes, needle. You can take the needle for free.
Okay, the needle for what? What the substance he will use?
For IV drug users, they know that he's an intravenous drug user, so he will go to the NHS service or the pharmacy. They can provide him with certain amount of needles, so they don't need to share needles with others. He will have his own needles.
His own needles still for the drug.
For drug,
Is it?
yes. We
Yeah.
are not
So we
preventing.
are helping him to inject himself with the drug.
Yes,
That's
but
it.
safely, yes, because
Okay, safely. But still
yes,
he can practice, yeah. Still he can practice drug abuse, but by his own needles.
yes, to
Okay.
prevent infection. And also for HIV patient or patient who are homosexually, we are advising them to have the PrEP, the pre-exposure prophylaxis, the HIV medication. This is also
Yes.
free. So
Okay.
we are not stopping the patient from having all these things, but try to have it safely. We are helping them
Yeah,
to
yeah.
advising that intravenous drug is not a good thing, but they are not listening. So we are helping them
So yeah.
not
Okay.
spread the infection. This
Yeah,
is,
to share clean and safe needles. Okay.
yes.
Okay. Please, if you have evidence for this program, yes, share it to the group.
I will do
Okay.
that. Thank you.
Thank you so much, doctor. Let's take the scenario, the second scenario. Thank you, Dr. Ahmed. Sorry. Okay. Dr. Awatif, are you ready? You have Mr. John, 55 years, complaint of lower limb swelling. Are you
Okay, 2
ready?
minutes كده 2
Yeah,
minutes
yeah,
وأستنى.
okay. Okay. Thank you, doctor, for the sharing of needle exchange services. It's new for us, but I like the way they are talking about. So if anyone interested, he can read about it. I share the link here, and it's already shared to the group. Thank you, doctor.
Okay, I will start. Hello.
Yes.
Yes, Dr. Awatif, yes.
Yes.
I share the timer. Are you ready? Dr. Mahmoud, please try
Yes.
to be closer to your mic. Yes, please. Let's start.
Hello.
Hello.
I am Dr. Ahmed, senior house officer in this clinic today. Can I confirm your name and age, please?
My name is 55 years old.
Mr. Ahmed, 35-year-old. Okay, Mr. Ahmed, we are here to discuss some issues related to your medical condition. Is it okay with you?
Yes, okay, doctor. My name is John.
Mr. John. Nice to meet you, Mr. John.
Nice to meet you.
Okay, Mr. John, it came to my knowledge that you are complaining in swelling in your legs. Can you tell me more about this?
Yes, doctor. Actually, I suffered from this leg swelling for the last 1 month.
Okay. Um, okay, Mr. John. Since 1 month, this swelling, is this increasing, decreasing, or the same?
Gradual increasing, doctor.
Gradually increasing. This first time, or there is a previous attack before this 1 month?
This first time.
Do you notice anything increase this leg swelling, like walking or standing for a long time?
Yes, when I stand for a long time, this swelling increase.
Uh, do you notice anything improve it, like raising your legs, for example,
A little bit helped me, doctor.
or using water tablets or water pills?
No, I didn't use any tablet for this. Well,
Okay. Regarding this swelling in your legs, is it in one leg or is it in both legs?
in both.
Up to where this is swelling? Is it above the knee or below?
This below the knee, above my ankles.
Uh-huh. Below knee, above the ankle. When do you try to press with your finger?
What?
Did you try to press on this swelling by your finger?
Yes.
It leaves mark or not?
Yes, it is a liver mark.
Leave mark. I'm really sorry for this. You beside that you have any pain?
Pain?
Yes.
No.
Any change in the skin color
No.
or appearance
No.
or skin change or skin rashes?
No skin rash.
Mm-hmm. Okay, Mr. John. Do you have any uh,
Yes. Hello.
yes كنت بوقف الزمن شوية يا دكتور باسم. Okay, yes, when I stop. Yes, beside that, you have any breathing difficulty
No.
in awareness of heartbeat?
No.
Any um, any change in your water work amount
No change.
or color
No.
or frequency?
No.
Any flow to water work?
Yes, I noticed that my water became frothy.
Since when?
Same period, doctor. 1 month.
Uh-huh. 1 month also. Okay. You have any pain while you are passing water work?
No.
Uh-huh. Okay. Um, beside that, you have swelling any other site in your body, like your eye
No.
or your tummy
No.
or any other site?
No swelling in my body.
Uh-huh.
Other organ.
Uh-huh.
Maybe.
Any past medical illness I should be aware of?
Yes, I have high blood pressure.
High blood pressure. Since when you have this high blood pressure?
Even the years.
1 year?
7 years.
7 years. Is it controlled?
Yes.
What medication you are on?
Yes, take amlodipine.
Amlodipine. Any recent change in the dose?
No.
This amlodipine is prescribed for you recently?
What?
This amlodipine is prescribed for you recently?
No, I'm using this amlodipine.
Any other pathological illness like high blood sugar
No,
or any other pathological illness of anything?
no, no,
Any
no,
liver disease?
no,
Do you have any yellow discolorations of your eyes?
no,
Any tummy pain?
no,
Okay. Do you have any joint pain?
no joint pain, doctor.
Back pain?
No,
Bone pain?
no,
Pains or skin rash in your body?
no,
Mm-hmm. Do you have any breathing difficulty?
no, as you said to, you know, blessing.
Sorry, you have any cough?
No,
Any medication list you are taking other than this amlodipine?
no other than amlodipine.
Any over-counter medicine you are taking?
No.
Any herbal medication?
No.
Any allergy to any medication?
And what?
Allergy to any medication? Do you smoke?
Yes,
Since when?
since this 10 years.
Since 10 years. Okay, this smoking has bad effects in our health, so we need from you to stop smoking. And if you need any help, I can refer you to smoking cessation clinic. Is it okay, Mr. John?
Doctor, thank you.
Do you take alcohol?
No,
Can I know what is your job?
I'm driver.
You are a driver. Okay, Mr. John. Is your condition affecting your driver performance?
Yes, so much.
I'm really sorry for this. Okay, we need from you to stop driving until we figure out your condition and provide your treatment and improve. Then you can continue uh, uh, driving. And also, I will contact the occupational health worker to deal with this. Is it okay?
Thank you.
Before going further, I want to ask you some questions. Do you have any change in your weight
No change in my weight.
or appetite?
No,
Any high temperature?
no.
Any feeling tiredness?
Little bit there.
Since when you have this tiredness?
Same this 1 month, doctor.
1 month also. Okay, this tiredness is increasing in certain time during the day.
Not related, doctor.
I'm really sorry for this. Okay, you have any pallor,
No pallor.
any lumps, bumps in your body?
No.
Okay, I need to examine you.
Okay.
I want the vitals of the patient and the blood pressure
Oh, blood pressure 135 over 85.
over 85. Okay, good. Okay. Also, I will check the patient appearance. Um, and I will check if there is any pallor. Do general examination.
No,
Um,
no,
I will go to the abdomen. I will see if it is distended or not.
not
Any,
distinct.
any surgical scar.
No,
I will do superficial examination. Any tenderness.
no tenderness.
Mm-hmm. Then I will examine the kidneys. Any palpable kidneys.
Not palpable. Not palpable.
Yes. Also, I'll go to the lower limbs. Um, to see if there is any change in the skin appearance
No,
and the extent of the swelling. I will check if it is pitting or not, and they are bilateral.
Yes,
Um,
Bailet.
yes. After that, I will go to check for any hepatomegaly also. I will check for heart if there is any murmur.
No,
Um, not the heart for murmur, sorry. I will check the back for any edema. Crepitation, basal crepitation. I will check basal crepitation.
no, Bailet.
Yes. What is your concern, Mr. John?
Yes, doctor. What's wrong with me?
Um, I highly appreciate your concern, Mr. John. From what you said to me after examining you, most likely you have this condition is related to kidney problem, which is called nephrotic syndrome. Um, the cause behind this most likely related to this long-standing high blood sugar. We have other possibility also, which is that medication that you are taking for high blood pressure, which is amlodipine. What we need to do for you, we'll do for you further blood test and also imaging for your tummy, and we will stop this medication and replace it by other medication so that we will put you under a group of specialists, include the kidney doctor and heart doctor, specialized nurse, occupational health worker, and social worker. You have any other concern, Mr. John?
No, thank you, doctor.
Okay, are you done, Dr. Awatif?
Yes.
Unfortunately, when you told me the time, something in the first 2 minutes, then I reset
You
the
can just
timer. Yeah, I reset the timer. So
comment
that's why
yourself.
I think it was 3 minutes past already. So almost now
أيوة.
13 minutes. Okay,
Okay.
if you're done, let's go to the examiner time, okay?
Okay.
He has time. Okay.
Yes.
Yeah, present the case.
Yes. This patient is young patient, male, came with lower limb swelling since 1 month and bilateral below the knee level. Beside that, he is complaining of frothy waterworks since 1 month. Also, he has pathological illness of hypertension since 7 years on the medication amlodipine, and also he has tiredness. On examination, he has high blood pressure, 145/85. He has lower limb swelling, between edema, actually. That's all what I got from history examination.
Okay. What's your differential?
My differential, this top differential is nephrotic syndrome, secondary to high blood pressure, long-standing high blood pressure, and also can be related to this medication, which is amlodipine, also, and also can be cardiac problem. Again, is that no cardiac symptoms? Can be liver problem also, but again, is that no signs suggestive of liver problem or liver failure or liver cirrhosis.
Could be thyroid.
No, less likely to be a thyroid because this patient has pitting edema.
Okay. What's differential of nephrotic syndrome patient?
Sorry.
Dr. Muhammad, we can't hear you. Yes, please.
What?
الصوت بعيد شوية شكله من الميكروفون.
What's the cause of nephrotic syndrome in this patient?
The cause most likely due to high blood pressure, There is no other cause in this patient. Can be other causes nephrotic, like malignancy, but again, is that no constitutional symptoms? Can be infection, again, is that no symptoms going with this? And also can be due to a rheumatological condition, and no signs suggestive this also.
What's your investigation?
I will do basic investigation, complete blood count, liver function test, renal function test, urea electrolyte, and urea and electrolyte and urine analysis also. I will do a specific investigation. I will do albumin creatinine ratio. And also I will check for high blood for the blood sugar, fasting blood sugar and hemoglobin A1C also. And I will do cardiac workup, investigation for differential, investigation for differential, cardiac workup, ECG and echo. That's all.
What's your treatment?
I will counsel the patient about his condition. I will give some advices for the patient, nutritional advices, and then I will treat the patient. I will provide acute treatment for the patient by giving diuretics to relieve this swelling, and treat the underlying cause. If it is medication, to stop the medication. Yeah, if it is renal, also I will consult with the patient and the multidisciplinary team follow up, including the kidney, the nephrologist, and specialized nurse, occupational health worker, and sociologist. And treat the underlying cause, including if it is medication, to stop the medication, and control the risk factor like high blood pressure.
Okay, time up. Thank you.
Yes. Okay, time is up. You can comment, Dr. Mahmoud.
Say my comment for the history as well. But she didn't ask about trauma. Okay. Also, she missed the family. She didn't ask. Okay.
Just get the microphone, yes.
What?
Adjust
Microphone.
your mic, Dr. Mahmoud. Yes, your mic. Adjust your mic.
In family history, she didn't ask. Family history. Okay.
Okay.
The social also, she didn't ask about recreational drugs and sexual activity for the HIV or any recreational drugs. In the investigation also can add urine analysis and lipid profile and coagulation profile. That is all. Regarding differential, this nephrotic syndrome, but we need to know what the cause behind this nephrotic. Also, she excludes that no diabetes. Also, this by examination, no palpable kidneys. Also, we need to ask about other causes like membranous dermatitis and focal segmental that can be precipitated by HIV and heroin. Also, malignancy, membranous colitis malignancy, and connective tissue disease, she exclude it like rheumatoid arthritis, SLE, and
Yes.
yes, idiopathic can be idiopathic membranous pulmonary investigation, antiphospholipid antibodies. Yeah.
Mahmoud, still there is problem in your mic. Please adjust the problem, please. Adjust the mic.
Okay,
Try to solve this problem. Yeah.
sorry for this. But overall, she did well, and this is the cause the catch case. Yes, but also in general review, she did most about CNS and endocrine.
To ask
So,
about what? To ask about what in the crime?
like whether preference for hypo.
You mean for thyroid? Okay.
What the relation, Dr. Mahmoud, between thyroid and kidney in this case?
Hypothyroid, one of the differential here, hypothyroidism can cause lower limb swelling.
Okay.
You mean myxedema? But the myxedema is non-beating edema.
Yes.
Are you done, Dr. Mahmoud?
Yes, also as a part of differential, you can put it in the bottom of differential, but we need to exclude it also.
Okay.
Okay. So you're done? Thank you, Dr. Mahmoud, with the case. Well done, Dr. Awatef. Please, again, I ask, be more clear in the sound because both cases are not clear from your side and Dr. Mahmoud's side. And the record, please, to be beneficial for all, please try to talk in a clear way and the mic to be more closer for the next times. Yes, thank you, Dr. Awatef. So let's start the comments. We have Mr. John, 55 years with lower limb swelling. The first thing, the data of the patient, Dr. Awad, you said to him, Mr. Ahmed, and you repeated it again. So be sure about the patient name next time. Okay, let's start from the complaint. It was lower limb swelling, onset course duration. It was started 1 month ago, gradually, with no previous attack. As you asked, was it worse with the standing? Yes, it was. Okay, Dr. Ahmed, it's okay. And both legs, what the level of this edema or the swelling, I mean, and does it leave mark when you press? Don't ask him, did you press over it? Ask him, when you press over it, it leaves mark or no? This is the question. When you press over it, it leaves mark, so it's pitting. If not, it's non-pitting edema. So don't ask him. Okay, thank you. The color, you ask for the color. I don't know what the relation. Maybe color of the urine.
No, the color of the skin. If there is any change, the color of the skin
Oh, okay.
for
So
other
you mean
differential
for the
only.
venous, yeah, for the venous,
And
for
yes,
example.
also
Yes,
complication.
okay,
Yes.
okay. The rash, yes, sometimes it will be associated with rash like venous ulcer or venous DVT. It will be with some rash. Okay, then you ask for the chest, breathing difficulty, cough. But before that, you can ask for kidney, direct question for the kidney affection. It's genitourinary mainly, or most cases genitourinary. So you ask for the color, amount, and frequency. Then you ask for the frothy urine. Along with this, you can ask about eyes, buffiness, or swelling around the eye. it will be also with kidney affection. This is for the genitourinary as a first possible differential. The second possible differential, the cardiac cause. So you will ask about the cardiovascular system, any heart awareness of heartbeats or any chest pain. Then the last cause or the third cause is the hepatic one. So you will ask about any jaundice in the eyes or in any change of the eye for the white or color of the eye. I mean the jaundice. Any tummy swelling or tummy pain or tummy distension, any change in the bowel habit. This is for the hepatic cause. So we have three common causes: the renal, the heart, and the liver. This is the possible causes of bilateral lower limb swelling. Of course, the denominator will be different, but in this case, it's bilateral. So this is the system mostly affected. Then you can ask a quick review about other system, the endocrine, the CNS, and the joint in this patient. No joint pain, the skin, no skin rash, constitutional symptoms, the weight, the appetite, the temperature, tiredness. Yes, it might be there due to uremia. Patient will feel tired. Then the social, the medical history of long-lasting disease. It was there, positive for hypertension, and the patient is taking amlodipine. By the way, amlodipine itself can cause ankle edema, so you can put it in the differential. You ask for the onset of starting amlodipine and any increase of the dose, any adding medication or any added medication. Then the history of allergy or surgical. You didn't ask about the surgery before. Very important, the family history. As Dr. Mahmoud mentioned to you, you didn't ask about family history. The travel history also you missed, and the HIV history at all, the recreational drugs. However, you ask about herbal medication. It's a good question. Recreational, you missed the casual relationships, just to roll out HIV. Recreational drug sharing needles, tattooing, piercing, and blood transfusion. The occupational, you ask for the job, it was a driver, and you ask him good question, is that affected your driving? Yes, so you can ask him, please, you can stop driving until we figure out your problem as you did. The smoking alcohol, yes, you cover this point. So our differential in this patient, let's go to the examiner, the examination first. Examination, you ask for the vitals, patient hypertensive, little bit, pulse, temperature, all will be within normal. You can ask for the anemia, any change in the hand, then the pulse, then the congested neck vein to rule out heart failure, any pallor or jaundice or swelling around the eye, in the face. Then you will examine the heart and the chest. Heart for any murmur or heart failure signs, chest as well. Find basal crackles. Then examine the leg itself, lower limb edema. Supposed to start by lower limb first, because this is the main complaint. The ankle is swelling, bilateral, you will see the extension, you will see the mark, and pitting edema, the level, and any color change, any change of the pulse, vascularity of the legs, I mean pedal pulse and posterior tibial pulsation. Then you can offer for the abdomen examination to rule out any stigmata of chronic liver disease, spider nevi, caput medusa, any ascites, any palatable kidneys. This is in general. Our differential will be, as mentioned, nephrotic syndrome, and you can mention either idiopathic or secondary for nephrotic syndrome. Cardiac cause or heart failure, I mean, and drug-induced due to amlodipine. This is the differential for this patient. So idiopathic nephrotic syndrome, secondary nephrotic syndrome, cardiac or heart failure, or drug-induced amlodipine ankle edema. Let's go to the investigation. Starting by basic workup, CBC, inflammatory markers, ESR, CRP, kidney function, urea electrolytes, creatinine, liver function test, and complement. In this patient, you can add complement levels and antiphospholipase, as Dr. Mahmoud said, for idiopathic nephrotic syndrome. Urine analysis is very important, and urine protein, ACR, albumin creatinine ratio, very important. And the specific test for this patient will be invasive for renal biopsy. You didn't mention, Dr. Awad, renal biopsy is very important in this patient. Ultrasound to check for the nephropathy by ultrasound, and X-ray in case of patient having a pulmonary edema, for example. Echo, ECG to rule out any cardiac cause. This is for the investigation. For the management, you will start by multidisciplinary team approach, including nephrologist, cardiologist, and a social worker, GP, specialized nurse. Then the non-pharmacological, including patient education, counseling about the disease and the complication, driving advice, and any positive history of HIV, you can advise in this patient. I don't know, you didn't ask, so I don't know what is the positive finding in HIV history in this patient. As Dr. Mahmoud said, there is something hidden in this patient. It might be related to or secondary to HIV. So the pharmacological will be treat the underlying cause according to the case. If hypertension, control the hypertension. By the way, also you can ask for the retinopathy in the patient by offering fundoscopy, either in the examination or during mentioning the multidisciplinary team approach. Retinopathy is very important. Nephropathy as well, very important. And other coronary vascular disease or coronary coronary vascular disease, very important in this patient, as lipid profile, atherosclerosis complication. The treatment according to the cause or according to the finding of renal biopsy. I don't know what the cause in this patient, Dr. Mahmoud, you can tell us, so we can treat accordingly. Anyway, we will, the general management, control the disease. Sorry? Idiopathic? Was it idiopathic, Dr. Mahmoud?
Yes, idiopathic.
Sorry?
Idiopathic, yes.
Yeah, idiopathic. Okay. So there is role of steroid in this patient? Cortisone, yes. Okay. So we can mention steroid as a management in the pharmacological. Plus control the comorbidity. Yes.
Other
We can't hear you, Dr. Mahmoud.
steroid plus other immunosuppressor.
Yeah. Okay. So it's idiopathic type of nephrotic syndrome. Hypothyroid can lead to pericarditis. Okay, let's read the comment. Cortisone, yes. Hypothyroid can lead to pericardial effusion and it can lead to heart failure in long standing. Also, hyperthyroidism as differential diagnosed non-pitting edema by peritibial mixed edema. Yeah, it was pitting edema, so we can't put hyper or hypothyroidism as mixed edema. Anticoagulant, yes, important in this patient as losing protein.
Is there any need to admit this patient?
Urgently, no. Arrange appointment, I mean.
Mm.
Because no short of breath, no orthopnea, no dyspnea. He just have lower limb edema. Unless he has any signs of heart failure or uh, renal crisis or frank pulmonary edema, this is the indication of admission, and in this way we can add diuretics. Okay.
If the albumin is very low, then it can be cause for admission also.
Albumin replacement, you mean? Okay, but still not the reason of admission. The reason of admission, either frank pulmonary edema or renal crisis, high blood pressure.
Or
But
dyspnea.
for this patient, it's not urgent admission. Yes, Dr. Mahmoud, you want to say?
Hello?
Yeah, we can hear you now.
Hello, Dr. Basim. I am Dr. Hassanin. How are you?
Dr. Hassanin, how are you?
Regarding, I would like to ask you about the cause of the nephrotic syndrome. If I reach the diagnosis early in the history, يعني should I search for the cause of the nephrotics by history and search for the complications of the nephrotic syndrome?
Yes, because you till you reach to the idiopathic type, you should rule out other
Yes.
cause.
يعني
So
which type of questions regarding the cause or the complication of nephrotic?
the cause like HIV, like some drugs.
I mean يعني which type of questions يعني regarding the history? Drugs, yes, drugs. Non-steroids.
Drugs,
Non-steroid,
HIV.
yes, minimal change for non-steroid. HIV for FSGS, focal segmental, yes.
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 Malaria was also. So
TB,
it's not TB, malaria, yes. So
membranous, yes.
you can ask as long-standing disease, you can ask as medical, but not specific question because
Broadly?
you will not ask you have malaria before, for example. But
Yes, yes,
HIV
of
is very
course.
important. You can ask about HIV by the question for HIV screening.
Can I ask about, do you have any previous malignancy or?
You can find in the constitutional symptoms.
Previous malignancies, if the patient cured and it is paraneoplastic maybe. I didn't know actually. It is, the problem we don't have much time in the focus history.
Yeah, that's why you can ask for the medical history. If you have any medical long-lasting disease or any previous surgery, any allergy, your medication list, it could help you to reach to the diagnosis or the underlying cause.
Yes, regarding the complications questions, regarding hyperlipidemia, increase in infection, thrombotic state, kidney injury. So it is mandatory to ask all these questions.
You can tell in the complication while managing the patient education and counseling. But the patient will present with this complication, you will reach it in the examination. You got it. If the patient came with acute kidney injury, for example, no urine or less urine output.
Yes,
so
I should ask.
Yeah,
yes,
you will
yes.
find. Yeah, you will find in the amount
yes,
of
you
the
find.
urine change.
Yes,
yeah.
Yes, I find it in the renal questions. Yes.
Either in the history, either in the
yes.
history or in the examination. Yes.
But what about the vitamin D deficiency? What about the increased risk of infections, hyperlipidemia? These all complications of nephrotic.
Yeah, you
Can
might
I ask
have
him?
also.
Can I ask him? Do you check your lipid profile recently, like this or not?
No, I don't think. Yeah, I don't think.
Mm.
You can ask if you have any history of stroke or mini stroke, any heart attack. But also you can find, he will tell you, he will not hide such event. If he had before heart attack, he will not tell you in the long lasting disease or previous
Yes.
attack or previous admission. He will tell you it's major event in his life.
Yes.
So the history and the system review will guide you to some hidden causes. Even if you're not asked about specifically about this disease or this complication, you might find it in the system review. Yeah.
Regarding the investigation, I think one of the most investigation in the nephrotic syndrome, it is antiphospholipase 2, antiphospholipase A2R, anti-PLA2R. It is
Yeah,
pathognomic
yeah.
for, yes, it is pathognomic for membranous nephropathy. And if
Yes.
if the patient have nephrotic syndrome and positive
Yes, we
this,
mentioned it.
yes, okay, I'm sorry. Yes,
No,
because
it's
this
okay. To repeat it, it's okay. Yeah,
okay,
go ahead.
because if this antibody is positive with typical feature of nephrotic, we may avoid the renal biopsy, which is pathognomic for membranous nephropathy.
Yes. Yeah. But still, the renal biopsy will be the diagnostic test for
Yes,
this patient.
it is. Yes, it's يعني gold standard diagnostic, but I think there is algorithm
Yeah.
in the MRCP or in the American guideline show that if the patient have a clinical feature of nephrotic typical with the anti-PLA2 A2AR positive, we may avoid يعني the renal biopsy.
The renal biopsy.
Yes.
Okay.
Okay.
Thank you, Dr. Hassan. Any question or any comment? Dr. Ahmed wrote, this will be part of the multidisciplinary team, especially nephrology team. Yes. So this patient will be treated under multidisciplinary team as we mentioned, starting by the nephrologist. Cardiologist is very important because such patient might have pulmonary edema due to heart renal failure and maybe suffer of overload. Plus other complication like high lipid atherosclerosis and coronary vascular affection or CNS like major vessel affection. I mean atherosclerosis. Aortic also dissection might be in the old age due to atherosclerosis, plus losing protein as thrombotic disease. Any other question? Any other comment?
Well, one small comment regarding at the beginning,
Yes.
the doctor said that I'm one of the senior house officer. The
Mhm.
patient doesn't know, he can tell her what is mean by that. So it's better to say
Yeah.
I'm a doctor here.
Yeah. Be simple while talking to the patient. Yes, I agree. Doctor, can I know your name, please?
Sarah.
Dr. Sarah? Okay. Thank you, Dr. Sarah. Even in the communication, I also prefer not to say senior house officer. Yeah, this is your position, but the patient doesn't know what's that. Just yeah, I am your doctor. Even
What?
it's written in the task. You are senior house officer or whatever. You only mention what's your
One of the doctor.
position. Yeah, which clinic or which department you are. But the position, it's not necessary to mention that you are senior house officer.
Yes.
Yeah, thank you, Dr. Sir. Okay, let's go to the communication. Dr. Hassanin, are you ready?
Yes, I am ready.
You will give me the case or I will give you first?
I will give you.
معلش
Okay.
I have one question بس before
Yes,
going to
sure, Dr.
communication.
Awad. Yes.
Regarding this patient, because the patient is free from any symptoms regarding the cardiac, should I do also work up for the cardio also?
ECG, you mean, and echo?
Yes.
Yeah, why not to roll out? To roll out, yes, cardiac affection. He has risk
drop.
of atherosclerosis.
Yes.
So most of these patients, you remember CKD patients, mostly they have coronary vascular disease.
Yes. Yes. Okay.
So you can add it, yes.
Okay. تمام. شكرا.
Most welcome. Thank you, Dr. Awatif and Dr. Mahmoud, for the long case today. We will do now the communication, me and Dr. Hassanin.
Hello,
Yes,
Dr. Basim. I will post the case in the chat box.
yes, please. Awaiting.
Okay. I think the chat box not working. He didn't
No, it's
accept.
working.
He didn't accept the posting. I will send it in the WhatsApp group. Is that okay?
Yes, okay, I will take it from there. By the way, cyclophosphamide, I found cyclophosphamide also one of the line of management in this patient, idiopathic nephrotic syndrome.
I posted it.
Okay.
And you can put it in the PowerPoint.
Yeah. Yeah, 2 minutes, then I will start. I will read it first. Mr. Bowman, 42 years, type 1 diabetes, diabetic nephropathy, and is now on renal transplant list. His wife, who is genetically unrelated, has been wondering whether or not to donate one of her kidneys. She has come to see you for more advice. Your task is to discuss the pros and cons of live organ donation with Mrs. Bowman. Okay. Two minutes, we'll start 25.
Okay. If you're ready, I will start. Hello, Dr. Basim. Are you ready?
Okay, I will share the timer.
I I don't know how to share it on the.
No, I'm the one who will share it. Okay. So let's start. Hello there.
Hello.
I am Dr. Mukhtar, the doctor in the clinic today. You must be Mrs. Bowman.
Yes, I am Spoman.
Yeah, you're the wife of Mr. Bowman,
Yes,
and he's 42 years.
yes.
How can I address you?
Actually, I come to the hospital.
Yeah, no, so I
Okay.
can call you Bowman. Yeah, Mrs. Bowman.
Yes, yes.
Okay. So we are here to discuss about Mr. Bowman condition. Is that okay for you?
Yes, of course.
Yeah. You are the next of kin of him.
Yes, of course.
Okay. Can I ask you a question?
Okay.
What do you know so far about Mr. Bowman condition?
Okay. Mr. Bowman, he has suffered from end-stage kidney failure since 4 years, and the hospital put him on the schedule, or what's called waiting list. So till now, we didn't receive any calls for his transplant issues. So I am concerned about can I give him one of my kidney?
I appreciate your worry about Mr. Bowman and your knowledge about his condition. Let me ask you before I address this concern, what's your expectation about this meeting?
Actually, my expectations is to know the positive things and the negative things of the transplant for me and for my husband.
Okay, I appreciate your worry and your concern, Mrs. Bowman, and we are here to tell you about the pros and cons of being a donor for Mr. Bowman.
Mhm.
So let me explain to you more. Or you want me to explain more about Mr. Bowman condition?
Yes, of course.
Yeah, so due to some disease Mr. Bowman is having, like diabetes, high blood sugar, his kidney being more destroyed because of this disease. And one,
Uh-huh.
yeah,
Mhm.
so you know about this, or you want me to explain more?
No, I know about my
Okay,
husband's conditions.
okay. So your question now about the donation.
Yes.
Okay. So let me tell you the good thing for being a donor for Mr. Bowman. The good thing that his body can accept your kidney without interaction or rejection. I mean, this is the good thing. The other good thing that it will be faster than waiting for what's called cadaveric, or waiting for someone who can donate him after death. This is the other type of donation in his condition. Till that time, Mr. Bowman can have what's called renal replacement therapy, but the list will be more longer till his turn will be there. So yes, it's one of the option to be a live donor for Mr. Bowman, Mrs. Bowman. Uh, are you with me?
Yes, I am with you.
So
Uh,
you understand what
so
I said?
yes, I understand you, doctor. You mean this is have much benefit for the Mr. Bowman, and he
Yeah,
will yes, improve his daily living and activities and social life.
yes, yes.
Mhm.
Actually, when he received the kidney,
Mhm.
he might be at home much better than before. He will not be frequently visitor to the hospital or the center for renal replacement therapy, which is dialysis, the alternative way of the management of his kidney. Uh, However, he will be kept on medication called immunosuppressive medicine. This medicine need to be taken by Mr. Bowman to suppress his defense system in order not to attack the new kidney or the transplanted kidney. And by some way, we are afraid Mr. Bowman will have some serious infection in the future. So we can advise you and him not to go and to visit a lot of people or to be existing in culture area or to be in contact with sick people. Are you following me?
Yes, I with you. Thank you. Okay, okay, doctor. So, what is the risk for me, please?
Yeah, I appreciate your concern and your concern is valid. So, Mrs. Bowman, in case you have any chronic or long-lasting disease, such your husband, Mr. Bowman, in the future you might have also a risk of having the kidney loss of kidney function. So at that time you might need to be on renal replacement therapy, or you might need someone to donate your kidney as well, to donate you his kidney. This is the disadvantage or the cons of being donating Mr. Bowman right now. You might need a kidney in the future if your kidney start to be unfunctioning. Are you following me?
Yes, I with you.
You have any other concern?
Yes, actually, I didn't. I don't genetically. يعني I didn't يعني genetically with Mr. Bowman. Is that okay?
Yes, this is one of the good things that you are not relative to Mr. Bowman, you mean, right? So
Okay.
sorry, no, it's not good thing. Sorry for that. The chance of being rejected, your kidney being rejected from him
Mhm.
will be higher percentage than being genetically related to him. I mean, in his condition, if he's donated by his son or his brother, the chance of being rejected will be less than being rejected from your kidney.
You mean
Did you
if
understand?
yes, you mean if I am don't genetically identical to Mr. Bowman, I cannot allowed to donate my kidney?
No, I appreciate your concern. This is not the point. What I mean that
Uh-huh.
you can still donate him, but
Uh-huh.
the most appropriate if he has someone genetically relative to him, like his brother or his son. It will be
Very good.
more adaptive to him.
Very good.
Did you understand that?
Yes, yes, I am with you.
You have any other concern?
No, thank you.
Okay, can I ask you some question?
Okay.
May I know what Mr. Bowman job?
Mr. Bowman, he is teacher.
Okay, does he need any help at home?
Yes, I am with him at home.
So who is dependent on him?
Actually, all the family is working. There is no one depend on him.
Okay, so does he need any help by any way, by any mean? Any social he need?
Yes, he is social support with his family and by me, and all the
Okay,
things. These things. Okay.
okay. Does he smoke,
No,
drink alcohol?
no,
Okay. Any concern you want me to address more?
no. Thank you.
Okay, I will hand you some leaflet brochures and website about the donation and the cons and pros of giving him a live or live donor. Is that okay?
Okay, thank you, Doctor.
Okay, time is up.
Okay, أشترك. Okay.
Yes, start please your comment.
Okay. Actually, I will directly go to the scenario. You first have the same introductions, and this was very good. Then, actually, I took this scenario from the Rider book. Is that okay? Communication Rider, chapter.
Yeah.
Yes, case 51. Okay. In the beginning of the interview, Ryder said that the husband and the wife should be both present and the consultation. This is number one. You should say to the, you can say to the his wife, can I bring, or do you mind if I bring Mr. Bowman with us today? You all take point for this action. Will take score for this action because both husband and wife should be at the consultation. Number two, you ask me about what do you know about your husband's state, or what do you know about the organ donation, and I answer you, and this and you cover this. Actually, you're explaining the organ donations. It is not perfect so much because when you mention the pros, the benefit of the organ donation, you can say the organ donation will remove your husband from the waiting list, and might he spend all his life waiting for organ donation, and this will help him in removing from the schedule of dialysis and improving his quality of life. And in your case, your husband has advantage over the what is called cadaveric donation, because when you in the same theater of the operation, we don't we have not to remove the kidney from one location to another locations, and the kidney will be a fresh sample, so it is chance to be functioning correctly. It is more than the cadaveric donation. This is number one. Number two, regarding living activities and the health status of the husband, and regarding the technical issues of the organ donation. We have 2 points regarding the advantage. Regarding the disadvantage of these, you should tell his wife that there is no guarantee that this kidney will still functioning or not rejected, because there is a possibility about the rejection of the kidney even with identical situation, or even with identical within a genetically identical donation, and because your husband, we will put him on the immunosuppressive drugs, and this will decrease his immunity, which make him more prone to the infections and other side effects. So there is no guarantee 100% for the correct functioning, the future of the correct functioning of your husband's kidney. The second one about the disadvantage about his wife. You should tell her about the small risk of developing hypertension after donating of one kidney. You should aware her about the psychological impact of donating one kidney. And very important things, you should told her about the whole preparations periods of investigations, and come to the hospitals and leave his works. So that may bring her at non-preferable situation regarding of financial issues. Okay. And then you should ask her about her insurance agency. You can say you should check your insurance agency about the implication of the organ donation. Okay. And the fourth or fifth things regarding her at the end of the consultation, you should ask her, and you should be completely ensure that there is no third party interest. You understand what I mean? Hello?
Yes, Dr. Hassan, I heard.
Hello? Are you hear me?
Yeah, I heard your comment, yes. But what I
Okay.
thought that
Okay.
it's
No.
still, this is, yeah. So you mean that this is
No third.
this, okay.
Yes, it is no. There is no network of marketing of these organs because it is legally forbidden. No third party interest. Okay.
What do you mean by that? So I will not tell her?
You should tell her in the sensitive way. This process will happen under the Human Tissue Act 2004, which is you should sign a consent that you don't receive money regarding this service. Okay, you and others person receive money regarding or receive benefits regarding this service, because it is legally forbidden, no third party interest. And at the end of the consultation, now you will enter the patient safety. You should talk with her about you should be well hydrated when the whole procedure was and after the donating of her kidney. You should avoid UTI with regular checkup. You should avoid nephrotoxic drugs and so on. And finally, say to her, I will access or I will contact the transplant team, and I will arrange a meeting with them. Thank you.
Okay. It's clear now. But I thought that still this is the first meeting with the wife to explain the pros and cons. That's it. Not
Yes,
to not yet decided for the not yet decided for this for donation. That's why no consent, no complication. I'm just addressing what she knows about the condition. Okay.
Yes, pros and cons. Pros and cons. If we can say a verbal consent or a verbal agreement.
Agreement,
or
yes.
Or a first impression about the issues. Pros
and
cons.
What do you think about
for,
that? Yes.
Yes. The benefit for his relatives or her relatives. The benefit regarding the improved health status and regarding avoid a cadaveric donation because it is a long-term process, long-term waiting list, and regarding the fresh sample of the transplanted organs, because we don't have to transfer the organ from one location to another location directly from your body to the body of your relative. This is the advantage regarding the receiver. Actually, the giver, he has no advantage except the psychological advantage, if we can say. So we focus about the disadvantage of the both. The disadvantage of the relative, it is no thing is guarantee. It is no guarantee 100%. And about the side effect of immunosuppressive drugs. The disadvantage or the risk for the giver of the organs. So you can mention a lot of things: hypertension, psychological impact, insurance agency. You have to leave your work and lost earnings, lost fees, because you will follow up regularly at the hospital, and so you should bear these financial problems. Okay.
Okay.
Okay. And the legal things, the no third party interest. And I will talk and I will arrange appointment with the transplant team to talk more about this process.
Okay. Okay, thank you, Dr. Hassanin. Yeah, a new case, I like this one. So this question from Dr. Ahmed: do we have to confirm the time of their marriage before raising issue of third party or money? I don't think we should ask about
No.
this. Yeah.
No, nothing like this, yes.
And survival of living donation graft is longer than cadaveric. Yes, you're right.
Yes.
Hyperfiltration from single kidney also. What the meaning of hyperfiltration from single kidney also? Can you explain, Dr. Ahmed, and pros and cons of hyperfiltration from single kidney? Yes.
Yes,
For
risk
both
of
cases,
hypertension.
both cases, either both situation will be single kidney donation.
I think he means the giver of the organs. He will be at risk of hyperfiltration in one of his kidneys.
Okay.
Mm.
Okay. So
Yes, for
I
why?
wrote yes.
Yes, for
I
why?
wrote yes for why. Yes. Okay. I wrote your case, Dr. Hassanin. Mrs. Lisa, 55 years, diagnosed with polymyalgia rheumatica. The consultant decided to start her on steroids.
I'm
Second
sorry,
her.
I have question.
Yes, sure. Dr. Abdullah.
First, Eid
Yeah.
Mubarak. كل عام وانتم بخير.
Thank you,
Uh,
Dr. Abdullah.
uh,
Likewise. Yes.
by any means, we shouldn't get exposed to part of pros and cons here are the maybe during the we shouldn't go to the how is it going, the procedure itself, the surgeries, or should we? Because if we don't focus on the mission is just pros and cons, and then if we maybe expand, then we maybe not enough time, right? Or we may ignore important stuff in our task.
Yes, it is good questions. Yes. Actually, many candidates explain to the wife or whatever the person who want to give his organs about the previous diagnosis, about the CKD, about the complication of CKD. I think this is wrong, and he will consume his time without benefit. In the same way, regarding the technique of the procedure, I think you should stick to your task. You don't have time to tell her about the general anesthesia, pre-op, intra-op, post-op. I think this is not matter in this case. You should stick in the scenario.
Okay,
Yes.
and sorry, another question about the insurance. It's not very understood to me. How do we know these rules? You mentioned the insurance in the discussion. I don't know.
Yes, actually, I take this scenario from the rider communication school. In the UK, these things maybe the organ donation a relative maybe draw from the insurance company, because if you donate one of your organs to the another ones, I think they have rules. Some companies of insurance, they will remove you of the insurance. So in the first, you should check the insurance company if the organ donation is okay, or if it is not okay, what are the solution for this? I think this is the point.
Okay,
Okay,
thank
thank
you.
you. Yeah.
Understood?
Yeah, thank you, Dr. Hassan. Yes.
Yes.
Okay. Any question, Dr. Abdullah?
Oh, no, thank you. Thank you so much. Yeah, explained.
Yeah. So the insurance after this, the wife will donate. If the patient will have certain complication, they might have no cover for this complication. This is the point, I think,
Yes.
because she donated by her own thinking, and so the insurance will not be responsible about the further
Yes. Yes. The
the
complications. Yes. Yes.
drawbacks.
Yes.
Yeah, the drawbacks of this donation.
The drawbacks. Yes. Yes. Thank you.
Okay. Any other question? Okay, your scenario, Mrs. Lisa,
Yes.
55 years,
Yes. Yes. What is
polymyalgia
my role?
rheumatica. Yeah,
What is my
to
role?
address the concern, the consultant decided to start her on steroids.
Yes.
Yeah, sit with her and address her concern.
Okay. Okay.
2 minutes, then we'll start. Okay, ready?
Okay. I'm ready.
Yeah, let's start. I'll show the timer. Okay, can start.
Hello. Hello.
Hello. Yeah, hello.
Hello. I am Dr. Hassanin. I am the treating doctor today in this clinic. You should be Miss Lisa, 55 years old.
Yes, I am. Yeah.
Okay. We are here to discuss your health status. Is that okay with you?
Yeah, sure, doctor.
Okay. Miss Lisa, please, could you tell me more a little bit about your recent health status, please?
Yeah, doctor, I have suffered a lot of these symptoms, being weak, tired all the day, some stiffness in my joints, and
Mhm.
then when I was admitted to your hospital and I did some investigation and workup. They told me that I have what's called polymyalgia rheumatica, and they told me it's unknown condition. They don't know what the reason of this condition. But they told me I should sit with you and have a meeting with you to tell me about the treatment.
Okay. I am sorry for hearing that news, but be sure we are here to help you. Could you please tell me what are your expectations from this meeting?
Yeah, I'm expecting you will give me a medication that will solve my problem and I will be fine and free of this disease in the future.
You mentioned that our colleagues say that you have what is called polymyalgia rheumatica. Do you want to explain a little bit about this?
Actually, doctor, when I hear about this disease, I Google it and I read more about it. Actually, doctor, I want to know what's the treatment of my condition. They told me that you will give me a medication and it might help in my condition. May I know what this the medication?
It's very good. So you want to from me to explain to you more about your conditions?
No, doctor, I read a lot of this information about the disease. Just
Okay.
tell me what medication I will receive, doctor.
Actually, okay, thank you. Actually, Ms. Lisa, your conditions is caused by inflammation of the muscles. And the inflammation, it is, I am sorry for medical term, it is over expressions of the whole, what is called the immune system. This system in the body is supposed to fight the bugs, and misunderstandingly, it attacks your muscles and your tissues. So in these situations, we can put you on what is called corticosteroids, and these drugs will help you and help your body to slow down these over expressions of the defense system in your body. So, did you ever hear about what is corticosteroids?
Yes, doctor. Oh my God. So the medication is steroid, doctor. I know this is steroid, dear doctor. I know it. It's horrible medication. I don't like it.
Sorry, it's herbal? Horrible. Okay.
Horrible
Okay.
one. Yeah.
Okay. I appreciate your concern, and it is normal to think like this way. Actually, the corticosteroids, yes, it have a much side effects, and we will talk about it. But in the same time, without these medications or these medicines, you will still suffering from this condition. You will still suffering from these pains and these stiffness and these tiredness and all the symptoms that you have. So with medications, we will get rid of these symptoms, and without medication, without this medication, your suffering will continue. So, at this point, are you with me, Ms. Lisa?
Yeah, doctor. But what I know, my uncle has hypertension because of this steroid.
Okay. As I said, it is. I understand your concern. The corticosteroids, actually, we will give it for you with a protection from your acidity, stomach acidity, which is called omeprazole, and we will give it with bone protections to protect your bone from the side effect of these drugs, and we will check your blood sugar level and your hypertension regularly, and we will monitor all these side effects you are afraid of from it. You are afraid from it, and if one of these side effects occur, we will catch it in its beginning, and so we will don't have further damage or further complications. So I am now to talk about the common of the side effects. Is that okay with you?
Yes, doctor, yes.
Okay. One of the side effects increase the acidity in your stomach, and this treated by and this can be prevented by giving you anti-acids and stomach protections, and may it increase you for further infections. And we will monitor your blood counts, and we will put our eyes on you to prevent this by regular checkup. And one other side effect is decrease in bone building, and this can be prevented by giving you vitamin D and calcium and other minerals, and check your bone density by scan. And as I said, all these complications can be monitored and treated in the correct time. So at this point, are you agree to start this medication?
Doctor, I have concern. My friend, she was taking this what's called steroid, and she gained a lot of weight.
It is a good question, really, and I appreciate your concern regarding the weight gaining because of the side effect of this medications. Yes, actually, it can occur because of this, but the benefits of this steroid of this medicines is much more than the disadvantage of it. Regarding the weight, we will put you on the scheduled diets and scheduled lifestyle, and we'll be minimize this side effect. As I said, the benefits of this medication is more than it is the disadvantage, because because you need this medication to get rid of this soreness in your muscles. Is that okay?
Okay, doctor.
Okay. Miss Liz, are you smoking?
No, doctor.
Did you drink alcohol?
Yes, doctor, I am taking alcohol.
Actually, this may aggravate the side effects of this medication. So my advice is I recommend it to decrease the alcohol consumptions to the normal levels. Okay. What is your job?
Okay, doctor. I'm retired, doctor. Just housewife.
Okay. Okay. Do you have any family members take care of you in the house?
Yeah, I'm living with my partner.
Okay, okay, that's good. I will give you brochures and some leaflets and websites and about these medications and about your condition, and I will arrange follow up in the next 2 weeks regarding the blood test and the follow up schedule. Is that okay?
Sure, doctor.
Okay, thank you very much. See you again.
Okay, thank you. Time is up. It's almost up. Okay, so let's comment. Very well, Dr. Hassanin. You did it perfectly. Just few comments
Yes.
for others, just to clarify the things. Okay, so let's start from the beginning. Introduction, introduce yourself, and confirm the patient data, patient name and age, and opening question, what do you know so far about your condition? You did that. Okay. Then, yeah, the expectation about our meeting, you did it well. Then you asked me very good question. You want me to explain more about this? I told you no, doctor. You
Mm.
ask me again. You want me to explain? I told you no, doctor. I read about it more. So
Mhm.
stick to your task because you have a lot of talk about the condition and the steroids. Not about the
Yes.
condition, sorry, about the steroid. And you see the time was not enough to explain all the complications. So what what I did, I tried to give you time to explain about the side effects of steroid. So no need to mention and to explain the disease. And while you are mentioning the disease, you said that the immune system, which is jargon. So you can say
Defense.
the
Defense.
defense
Yes.
system attacking your muscle, your joints. Yes. Then go directly to the task. What is the task? Yes, we will start you, or the consultant advised or decided to start you on a medication called steroid. Do you have, as you said, have you ever heard about steroid? Yes, I agree. This question is, yeah, perfect question. Have you ever heard about steroid? Yes, doctor, I heard about it. I read a lot about a lot of side effects of this medication. What are they? May I know? Or you can mention it. Either she will do or you will do. It doesn't matter. But if she asks, you can give her a chance to ask. Yes, what you hear about? Yeah, my uncle has hypertension because of steroid. I appreciate your knowledge. I appreciate your reading about this steroid. And your concern is valid. Yes, it's one of the complication or unwanted effect of this drug or medication. And for this reason, we will do some precaution to prevent the side effect or the complication. Then start to mention the the side effect and how to prevent it. Starting by her concern, hypertension. Yes, you're right. There is complication, hypertension, one of them. And to prevent this hypertension, we will put you in a dietitian program to prevent or to restrict your salt intake in order to prevent the hypertension, as well as we will follow up you and we will keep our eyes on you, as you said, in our clinic to measure your blood pressure frequently and be sure that we will not leave you in this journey alone. Then you start to mention the other side effects, as you did. The stomach. Yeah, one of the other complication is the soreness in the stomach. And to prevent this, we will start you on a medication called omeprazole or proton pump inhibitor or antacid, as whatever you say. But we will do it in order to prevent the soreness of your stomach. Then the other complication called osteoporosis, which is decrease in the bone building, as you said, or the bone will be more weaker than normal. And in order to prevent that, we will start you on what's called vitamin D and calcium and some supplements, as you said. Then she asked you, Doctor, I read or I heard about my friend, she gained weight. This is one also of the complication. Yeah, I appreciate your concern. That's why we will advise you or we will follow you with our dietitian expert. They will guide you how to do the regular diet and exercise, and they will put you in a diet regime will help you not to gain weight. It's very important for you. And the diabetes, one of the complication as well. And we will follow up your blood sugar level frequently to prevent this complication. So each complication and how to prevent that. And always keep saying we will follow up. It's one of the welfare that you are not leaving the patient. We will follow you. We will follow you up all over this time of the medication. Then the social as you did, the alcohol is very important to ask, but ask the amount. Maybe it's still within the social limit, or even within the social limit, you can advise here not to increase or to reduce it because yes, it can cause pseudo crushing, and this is also uh, will lead to Cushing or pseudo Cushing syndrome. So you can advise her not to drink. Uh, although she cannot stop it, at least you can advise her. The smoking and the job, that's it. The leaflet brochure at the end, website, and yeah, sorry, I missed this point. Very important. Always any medication we are prescribed to someone, we prescribe in the best of interest for him. And the steroid is one of the best interest of your condition. Yes, there is a lot of complication, but when we weigh the risk and the benefit, the benefit outweigh the risk too much, and it will be beneficial for your condition. And we
Yes.
found that the steroids minimize the symptoms and the complication of the disease.
Yes.
Very important point in this patient, and one of the red flags, what's called giant cell arthritis. You can put it in a NB notebook as a red flag. Be careful. This disease is associated with what is called giant cell arthritis. What you mean? It's one of the complications that affect the eye. It might cause sudden blindness, sign blindness. You will be unable to see suddenly, all of a sudden. Please, if you have suffered this, visit us immediately. Immediately. It's very important to prevent the complication. It might lead to permanent blindness. So
The hidden
please,
agenda.
yeah, this is hidden agenda, yes. So add it in your book or your mind that whenever you have polymyalgia rheumatica, give a red flag about giant cell arthritis. It's very important. Okay, this
And
is the
also
case
chest
here.
pain. And also chest pain if aortic dilatation occurs.
Aortic for what? Aortic regurgitation
Aortic يعني dilatation because it is
due
cause
to,
aortic aneurysm.
due to steroid or due to the disease?
No, due to the giant cell arthritis, vasculitis. I mean, it is one of
Vasculitis.
the
Okay,
yes, it is one of the rare complication of the giant cell arthritis.
okay. That's it. This is the case. But steroid is very common scenario for patient counseling about the medication, steroids. Memorize these 4 or 5 complications and try to mention it by yourself or to mention them by yourself, or if she asks you to mention them. Of course, there is other complication like psychosis, like cataract,
Yes,
but the common is common. What's the common? Bone, osteoporosis, stomach, or peptic ulcer, hypertension, diabetes, and weight
infection,
gain.
infection or gain.
And frequent infection, yes, frequent infection, and weight
Weight,
gain.
weight.
Yes. So this is our case today as a communication. Any question or any comment? Dr. Hassan, you can add also steroid is one of the known and historical medication that known to be beneficial to some people or some patients. If you want just to introduce the steroid, okay?
I didn't understand you. What you mean
Yeah,
exactly?
steroid is one of the old medication used for a lot of disease. One of these
Uh-huh.
disease is polymyalgia rheumatica.
Uh-huh. Okay.
Okay, but we are using it for a purpose, not for just yeah. Because maybe she will tell you why you are giving this medication to me. I don't want to take it. Some 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 people take for gaining weight, for example. But no, we are giving it for best of interest of your condition. You have a disease, and this disease is responding well to this medication. Dramatically improvement of the symptoms after starting steroids. I mean for polymergia rheumatica. Okay. If no question, no comment. Any question, any comment? Anyone wrote in the chat? I guess this case was clear, but it's one of the common and high yield topic in the communication. Steroid as a communication case. Okay.
I think
Yes.
because the patient say you told him by your own that this is the horrible medication, and then you told him the cause of this is this in the exam. I think the patient won't say the cause. So when he says that it's horrible medication, we should explore why you think it's horrible. Is any specific reason for that? So
Yeah.
he say, but you make it for him easy by telling him the blood pressure and also the weight. And the other thing we can say, we are not doing all this weight management and all the patients that are having steroid. We can say that for polymyalgia rheumatica, we'll give a low dose of steroid, which 50 milligram per day, until your symptoms will improve after 1 month. And then after that, we will try to wean when your symptoms are controlled, the weakness and you have this rigidity or the spasticity, any symptoms that the patient is having, we will wean the steroid as much as you can. And during all this time, I know that the steroid it has a lot of side effect, but we should weigh between the benefit and the risk, because the we can raise at this time that polymyalgia rheumatica, if untreated, it can cause giant cell arthritis, which can cause permanent loss of vision and these things. And also, we want to tell you that we will monitor for the side effect by monitoring your blood sugar. We'll give you medication for gastric, for protection for your gut. And maybe we will do for, I think if his patient is less than 14 years, you are not doing DEXA scan for him for osteoporosis and these things. So we'll close monitoring any side effects that you will have and try to find alternative to treat it and to avoid the side effect or reduce it. But we are not doing weight program for him and these things. This is not practical to ask the patient for any patient on steroid to check for his weight and these things. We are not doing this. We will tell him that we will close monitoring for the side effect by checking your regular checking your blood pressure, blood sugar, and as I said at the beginning, we will address, because the patient will say something that I don't want the steroid because this specific thing. So we'll try to address his concern about that and tell him we will try to, we appreciate this is a concern, but this will, we need to weigh between the benefit and the risk and ask, and then tell him, what do you think about that? Are you following me in that? So the patient will say, okay, so I'm convinced to have it as long as you will follow the side effects. So I think it will be like this stage.
Yeah. Thank you, Dr. Sarah. Yes, you're right. I mentioned it like that, horrible. And the same time, yes, he should ask me why you think it's horrible. Yes, I agree with you.
Yes.
So yeah, I'm trying to be volunteer for teaching purpose, but
Yes.
in the exam way, yeah, you should raise up all this complication by yourself. Don't wait for her to tell you, I'm afraid of gaining weight or whatever. You
Yes.
should be the one raising this complication by yourself and
Yes.
tell her how to prevent that. Yes, I'm agree
Yes, right.
100% with you. Thank you,
Okay.
Dr. Sarah.
Okay.
Yeah, you summarized the case in 2 minutes.
Yes.
Thank you so much.
Okay.
Okay, Dr. Abdullah, should we mention that the link to neurologist because polymyalgia rheumatica and giant cell is in some cases difficult to respond in short duration and may need further review or steroid-sparing drugs. In some cases, difficult to respond in short duration.
Yes. The treatment usually for 1 year, or maybe it can be extended. But if the symptoms are controlled, we will wean the dose of steroid.
Yes.
Yes. So we'll tell him that treatment you may have is because in this station the patient need to know for how long he will have the steroids and what and he will say for 1 year, so I will have all these side effects for 1 year. So we'll tell him no. If your symptoms are controlled, we will monitor your symptoms. We'll closely monitoring the symptoms. We'll closely monitor the side effects, and if everything is controlled, we'll try to gradually wean the steroid, and at the end we'll stop it. And also we
Excellent.
need to tell him that we need to advise him and make that he couldn't stop the steroid on its own, because the sudden stopping of steroid can cause
Yeah,
you
Addison.
need also mention this as a safety netting the patient, that
Yeah.
he should stop the steroid on its own. It should be gradually wean it, trap it from the body, because to prevent any sudden withdrawal. And this is one of the medications that we couldn't stop it suddenly. I think all of the things we should cover in this patient.
Yes, you're right. Yeah, this is also one important point, to advise him not to stop it by his own.
Yes.
It need to be gradually withdraw.
Mm.
And yeah, in case if he will stop it suddenly, it might lead to certain complication, more maybe life-threatening one, which is addiction crisis. Yes, you're right, Dr. Sarah. Thank you, Dr. Sarah, for your share. And yeah, nice case, nice presentation by Dr. Salim. Any other question? Any other comments? Okay, if no question, we can end the record, and we will have the nomination for tomorrow. Thank you all.
Dr. Bas.